Hi, I'm Harry. I'm an osteopath, as you know. I also designed the Manta Foam Roller, so this is my foam roller. We will be focusing mainly on sort of low back and low back related stress points today. Almost everything we do, you can either use a normal foam roller or it'll be exercises. There's one or two bits where you can't use an ordinary foam roller, but we'll go through that when we get to it. Okay, great. We're going to start nice and gently. So, often people with low back pain usually stiff in the mornings. That's because when we're moving, the muscle contractions and gravity help get all the inflammation and everything moving. Being horizontal and not moving for 8 hours or whatever you are sleeping for means it all gets big stagnant. So often people with low back pain in the mornings, this is a great one to start with. So we're going to start with some knee rocks. So knees and ankles are together. Really gently, just starting quite small to begin with. We're just getting the lower back moving by getting our knees going from side to side. If you want, you can experiment. Lots of us, I automatically have a little bit of a gap between my low back and the floor or the bed or whatever you're doing it in. So you might want to try and flatten that out. And you'll automatically notice you probably can't rotate as far, which is absolutely fine. And it's good to mix it up. And you never really want to go past sort of 45-degree angle anyway, because then it sort of gets a little bit too high. And again, 30 seconds is a really nice way to start the day. This is often followed by knee hugs. So we're going to either, if you've got acute low back pain, then you might just want to do this one at a time. For most of us, we can do it 2 knees at a time, and we're going to suck our knees in towards our chest. Now, the only thing you have to remember with this is that your knees and your legs, you want to be absolutely loosey-goosey. So no, you're not trying to force it in with the knees, because that will switch on the muscles in the low back. So we're just using our arms and our biceps to squeeze in gently, holding it for a minute or so, for a second, 10 seconds or so. And this is just opening up some of those joints in the lower back. And I tend to hold for a little second or two, drop out, and then come back in. Great. Now we're going to do a little bit more of a powerful stretch for the low back. So we're going to have one knee up at sort of 90 degrees, hand on the outside of your knee. We're going to roll over. I tend to have the other arm pointing out. We're going to twist through. Try and keep your sort of shoulder blade and mid-back relatively on the floor. Should feel a bit of a stretch through your glutes, a little bit of a stretch through your low back as well. And you can just ease it a little bit further, hold it for a moment when you feel like you've got a nice stretch, and then as you breathe out, see if it can go a millimetre further. Great, we're going to come to the other side, arm out, palm facing up, going the other way, knee coming down. Now, some of you really nice mobile yoga people will be able to go all the way down and keep their knees on the chest. I am not that person, so that's why my knee isn't all the way down. Let's come back, do the other side. And back again. Great. And let's just do a little quick knee hugs, just to calm it all down, stretch it out again. Great, so we're now loosened up a lower back. We're going to go and stretch one of the most commonly tight muscles that I treat and lots of therapists treat, which is your piriformis. So that's the muscle that goes from your sacrum around to your hip. And the issue with it is that it sits right on top of your sciatic nerve. So if that muscle's really tight, it can be one reason you're getting some irritation going down the leg following that sciatic nerve pathway. So lots of people know the sort of figure four stretch. So when you have one ankle on the knee, hugging under, pulling up. Personally, what I prefer and find more powerful and useful is starting with your knee at 90 degrees, turning it in, holding on to the outer shin with one hand, outer knee with the other, and then you're squeezing in and across. So compared to the figure four stretch, you can get much more leverage, and also you can play around with slightly different angles to get slightly different muscle fibers. So this is a really nice one. I tend to hold this 10 seconds or so. And then we'll relax. Let's switch and do the other. So turn the ankle in, onto the outside of the knee, in and across, or wherever you feel you get that maximum tension. Great, let's switch. I tend to aim for sort of 10 seconds of 3. It's not based on loads of science, more just sort of what I like. And switch. Switch last time on this side. Play around with a few different angles, see where you can get that maximum pull. And last one, in and across. Great. And come and sit up. What we're going to do now is move on to foam rolling some of those deep muscles of your glutes. So, foam rolling is really useful. Most of us have slightly bony bits around the bottom. So we're going to be focusing on using the central prongs for this one, because it can get in between your pelvis and your sacrum and really target those deep muscles, unlike smooth foam rollers, which tend to hit bone before being able to get into the muscle itself. So what we're going to do, we're going to start with one cheek, whichever cheek you want, you choose, sitting slap bang in the middle of this foam roller. So my cheek's right on top of one of these central prongs. We're going to cross that leg over, okay? So whichever cheek you're foam rolling, you want to cross this leg over. This puts a little bit of a stretch through your piriformis obturator muscles, so they're a little bit tight, and then we're going to roll through here. So it's quite a small movement, because unless you have a very large bottom, it's not that big a space. And those muscles we're rolling over are going horizontal across. So we're cross-fibering, going up and down to try and release some of those pressures. And just play around with your angles. So start shifting your weight. You can come up a little bit more vertical and then drop that weight over the top, and you will find, or 1 or 2, satisfying yet tender areas, I've no doubt. The sore areas are not an issue so long as it's not agony, and when you hit one, just either oscillate gently over it for a little bit longer, or just hold it, breathe in and out. But I always prefer a little wiggle personally. And again, 30 seconds or so, keep that angle changing, support yourself with your hands. That feels good. If you want to make it a little bit harder, you can, in this same position, pull your knee across your chest a little bit to get even more of a stretch through that piriformis and obturator muscles, and then really feel that foam roller getting in nice and deep. Great for anyone that gets mild sort of sciatica if it's not coming from the disc. If it's very acute, then this will probably be a bit too much, so take it down quite a few notches before you do anything. And then we're going to do exactly the same on the other side. So switch glutes, get nice and comfortable, cross that knee over and start rolling through, changing your centre of gravity. And if you want, you can really go to town by pulling it across your chest even further. For lots of people this will be unnecessary and a bit much, but for those of you that are either very flexible, so if you've got really mobile hips, you might need to add in a little extra stretch to get tension through those muscles. Or if you're like getting a deeper, more sort of profound massage, then try pulling the knee across your chest. Oh, brilliant. We're going to come down. Okay, now we've loosened off our glutes, we're going to go into a pelvic bridge because we like activating, strengthening muscles after we've loosened them off as well. And this is a really good all-round exercise. So I'm sure loads of you have done this before, but if you're new, then just follow me. So we're going to lie on our backs. We're going to bend our knees. We're going to engage our core muscles. So what we're going to do here is we're going to try and use our lower abdomen muscles to suck our pelvis up, which means we're flattening out. So think about, if you're struggling with that, think about pulling your tummy button towards your spine, and that will naturally flatten out any gap you have in between your lower back and the floor. And once we've done that, so we've flattened our low back, engaging all of these muscles around here, our transverse obliques, our abdominals, our lower back muscles, we're going to squeeze our glutes together, and we're going to pull on our pelvic floor and slowly lift up. Now, what we don't want is a big arch. So when you're going, you want to be fairly smooth through hips into your knees. And what we're going to do to begin with is keeping everything tight. So we're still engaging our core muscles, still engaging our glutes and our pelvic floor, and we're just going to hold this for sort of 15 seconds or so. And then we're going to slowly come down. So while you kept keeping everything engaged, all these muscles switched on, we're going to try and drop down segment by segment through the spine until we get all the way down, and you only relax when you're all the way down on the floor. And then we're going to repeat that, okay? So we're going to flatten out our low back, engage, squeeze our glutes, suck up the pelvic floor, gently lift up, hold, and then slowly drop down segment by segment through the low back, and relax everything once you're all the way down. If you're finding that quite easy, then one quick way to make it harder is to do exactly the same thing. We're going to all do a pelvic bridge. If that's about your level, then just keep both feet on the floor. If you want to take it a little bit further, come into that position after switching and sucking everything on, and then straightening one leg, hold that. Brilliant, leg down, segmentally drop, 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 and relax. We're going to do it one last time, either 2 legs on the floor or 1 leg if you're finding it easier. Well done, drop that foot down, segment by segment. Brilliant, and relax. The penultimate exercise is foam rolling our lower back. Now, most foam rollers you shouldn't use on your lower back pretty much ever. That's because there's a real risk of overextending, and to stop us from doing that, we have to flex our lower back, which means the bones that stick out of the spine stick out even further, and so lots of foam rollers will just hit your spine and miss all the muscles around it, which is fairly pointless. So if you've got a roller that's got a spinal groove, great. If you haven't, hold on 1 second and I'll give you an alternative. So this time we're going to feel our spine into the groove, starting at our lower back. We're going to place our hands by our sides, lift the pelvis a fraction off the floor, and just roll through nice and slowly. This is really hitting the central prongs are getting both sides of my spine into the really important postural muscles down there. The one thing you've got to be really careful of, and don't do this, is you don't want to get too horizontal and overextend because there is too much pressure going through there. So you've got to remember to always keep your chest high. So either through using your hands or just using your core to stay high so you don't overextend. If you're using an if you're using a normal foam roller, a different foam roller, then if you remember the child's pose we did last time, I would do that instead, because it's really important you don't use other foam rollers on your lower back. But if you're happy and have a decent foam roller, then just sort of 30 to 60 seconds. Don't go too fast, too quick. I tend to tuck my t-shirt in. The skin on the lower back is quite sensitive, so if you're doing it topless, sometimes it can get a little bit friction burny, so either use a little bit of moisturiser cream or just tuck your t-shirt in and watch it get pulled out. Great. Couple more seconds. Brilliant. And then let's finish off with my favourite, the old suboccipitals. So as usual, right at the base of the skull, drop that chin down, and we're going to hold it there. Excellent. Come up nice and slowly and enjoy the rest of your day.